Early warning signs of dementia you shouldn't ignore. Dementia is a progressive condition that affects memory, thinking, behavior, and the ability to perform everyday activities. While it is commonly associated with aging, dementia is not a normal part of growing older. The earlier the signs of dementia are recognized, the sooner interventions can be put in place to slow its progression and improve quality of life. Since dementia develops gradually, it often begins with subtle symptoms that might be mistaken for normal forgetfulness or stress or even other illnesses. However, over time, these signs become more severe and start interfering with daily life. Recognizing these early warning signs can help individuals and their families seek medical evaluation and support at an early stage. Let's get started. 1. Difficulty finding the right words. Struggling to find the right words is an early indicator of dementia. A person may pause frequently during conversations, searching for a word they know but can't quite recall. They might also substitute words in odd ways, such as calling a watch a hand clock or referring to a refrigerator as a cold box. Over time, their speech may become disorganized, making it harder for them to express themselves clearly. This communication difficulty can lead to frustration, social withdrawal, or confusion, as they may avoid conversations to hide their struggle. 2. Confusion with time and place. A person in the early stages of dementia may lose track of time, dates, or seasons. They might forget what day of the week it is, struggle to remember upcoming events, or even feel disoriented in familiar places. For example, they may step out for a walk and forget how to get home, even if they have lived in the same neighborhood for years. They may also misinterpret time, thinking it's morning when it's actually evening. Such spatial and temporal confusion can cause a person to feel anxious, overwhelmed, or fearful in new or even familiar environments. 3. Memory loss that affects daily life. One of the earliest and most noticeable signs of dementia is memory loss, especially short-term memory problems. A person may forget recent conversations, appointments, or events, even if they happened just moments ago. At first, these memory lapses may seem minor. A person might forget where they left their keys or struggle to recall a name they recently learned. But over time, these episodes become more frequent and severe. They may start repeating themselves in conversations, asking the same question multiple times, or forgetting important obligations. Unlike normal age-related forgetfulness, dementia-related memory loss makes it difficult for a person to retain new information. They may rely heavily on notes, reminders, or family members to remember routine tasks. 4. Difficulty completing familiar tasks. Tasks that were once easy, such as preparing a meal, following a recipe, or paying bills, can become overwhelming and confusing. A person with early dementia may forget the steps involved in simple activities or lose focus midway through. They might start a household chore but leave it unfinished, or they may struggle with using everyday appliances like a microwave, phone, or television remote, despite having used them for years. This increasing difficulty with familiar tasks can lead to frustration and avoidance of responsibilities, making them more dependent on family members for daily activities. 5. Poor judgment and decision-making. A person in the early stages of dementia may begin making uncharacteristically poor decisions. They might fall for scams, give away large sums of money, or buy unnecessary and excessive items. Other signs of poor judgment include neglecting personal hygiene, dressing inappropriately for the weather, or failing to recognize dangerous situations. Because dementia affects reasoning and critical thinking, a person's ability to evaluate risks, prioritize tasks, and make sound choices starts to decline. 6. Difficulty with planning and problem-solving. Managing daily responsibilities, such as paying bills, balancing a checkbook, or organizing appointments, may become overwhelming. Tasks that involve numbers, organization, or following step-by-step instructions become difficult. For example, a person with early dementia may struggle to follow a recipe, make a grocery list, or remember to pay their monthly bills. They may also take longer to make decisions or abandon a project midway because they can't remember what they were doing. This decline in problem-solving ability can affect both personal and professional life, leading to frustration and a loss of confidence in one's abilities. 7. Changes in mood and personality. Dementia doesn't just affect memory and cognition, it also leads to emotional and personality changes. A person may become more irritable, anxious, or depressed. They may also experience mood swings with no clear reason, shifting from calm to angry or from happy to upset in a short period. Some individuals may withdraw from social activities, lose interest in hobbies, or become unusually suspicious of others. They may even accuse family members of stealing, hiding objects, or lying. In some cases, dementia can lead to increased impulsivity, inappropriate behavior, or a lack of awareness of social norms, which can be distressing for loved ones. 8. Misplacing items and losing the ability to retrace steps. People with dementia frequently misplace objects in unusual places. They might put their wallet in the refrigerator, place keys in a drawer where they don't belong, or even lose items and be unable to remember where they last had them. More concerning is the inability to retrace steps. A person without dementia may misplace their phone but remember retracing their steps to find it. Someone with dementia, however, may not recall when or where they last used the item and may even insist that someone else has stolen it. This increasing frustration and confusion over lost objects can contribute to paranoia and suspicion. 9. Withdrawing from social activities. Because dementia affects communication, problem-solving, and emotional regulation, many individuals start avoiding social situations. They may feel embarrassed about their memory lapses, trouble finding words, or confusion, leading them to withdraw from friends and family. They may also lose interest in hobbies, stop attending community events, or become less engaged in conversations. As a result, they become more isolated, which can contribute to depression and worsen cognitive decline. 10. Difficulty understanding visual and spatial relationships. Dementia can impact vision and spatial awareness, making it difficult to judge distances, read signs, or recognize faces. A person may struggle with driving, as they may misjudge distances, react slower, or fail to recognize road signs. Reading, as words may appear jumbled or harder to comprehend. Navigating spaces, such as struggling with stairs, tripping over objects, or misjudging doorways. These visual and spatial difficulties increase the risk of falls and accidents. If you or a loved one notices several of these early warning signs, it's important to see a doctor as soon as possible. While some memory problems can be caused by stress, depression, or other medical conditions, persistent cognitive decline should never be ignored. A healthcare provider can perform cognitive tests, brain scans, and blood tests to determine whether dementia or another condition is causing these symptoms. Early diagnosis allows for better planning, lifestyle adjustments, and possible treatments that can slow the progression of dementia. Dementia is a progressive condition, but recognizing its early warning signs can make a huge difference in how it's managed. If you notice persistent memory loss, confusion, mood changes, or difficulty performing everyday tasks, don't ignore them. Seeking medical advice early can lead to better interventions, support, and an improved quality of life. If you or someone you know is showing early signs of dementia, now is the time to take action, because early awareness leads to better outcomes. If you found this video helpful, give it a thumbs up, subscribe and share it with someone who might need this information. Let's spread awareness together.